Hello, everyone. Dr. John Schaefer here, physical therapist. Really looking forward to this video as I feel like there's a lot of value. Today, we're talking about patient interactions, how to make the most out of those interactions, and how to utilize those skills to get your patients better and get them better quickly. The number one indicator of improved patient outcomes is whether or not the patient likes their therapist. Think about that again. Isn't that crazy? I'm going to say it one more time. The number one indicator of improved patient outcomes is whether or not the patient likes their therapist. It's not the therapist's skill. It's not their knowledge set. It's not what certifications they have. It's whether or not their patient likes them. That's crazy to me. I've spent so much time investing in my education, trying to acquire all these different skills, learn different things, get different certifications. But at the end of the day, none of that matters unless the patient likes me. That's crazy. But a lot of patient care comes down to the interaction between the PT and the patient. So with that being said, doesn't it make sense that you want to invest in your people skills and practice your ability to converse with others? It's going to pay off. And even beyond that, your ability to educate simply and make people feel comfortable goes such a long way in terms of providing a high level of care. A lot of my patients come into PT, maybe they've never had physical therapy before. The first thing I try and do before I even ask them questions about why they're coming in is ask them, hey, have you ever had physical therapy before? They're coming into this new space. They don't necessarily feel comfortable with the way things are going. So if they haven't, I tell them, hey, if this is your first time in PT, here's what you can expect from me. I'm going to ask you some different questions, get a better understanding of what you've been dealing with, and then together we'll come up with a game plan of how we can get you feeling and moving a little bit better. And this is going to take place through me watching you move, doing a couple different tests, and then trying some different movements to see what works and what doesn't. This is going to be a team effort. And when you say things like that, the patient lowers their guard and they're willing to be, they're willing to participate in the session. They're willing to, contribute their thoughts, their feelings to make sure that you both are on the same page. But with all that being said, that's not to say forget about the textbooks. Don't worry about clinical reasoning. Don't focus on perfecting your craft. It's just a reminder that although a high level of textbook knowledge is great, at the end of the day, you still need to be able to communicate that knowledge with your patients. So some of you may be fantastic with people, while others might struggle. No matter where you're falling on the spectrum, entering a new rotation, a new job, whenever you're starting to try and work on some of these skills, you're always going to have those same initial challenges of trying to get to know new patients. And it can be pretty anxiety inducing to meet so many new people so quickly, try and remember everyone's names, their faces, facts about them. I don't know about you, but meeting new friends in a social setting, sometimes it's hard to keep up with even 2 or 3 new faces, let alone like 30 or 40 new people a week when you're starting a new job or new rotation. So to ease this transition, improve your comfort in the clinic quickly, I highly, highly, highly suggest investing in getting to know these people, these patients, these clients as quickly as possible. And people are usually, very excited and open to talk to new students, new employees when it's their first day. It's like, who's this new guy? Who's this new girl? Let's, get to know them a little bit. So an easy way to have these conversations without disturbing the flow of the sessions is just talk to individuals as they're warming up, as they're doing, movements that they're comfortable with, have done a lot. They're not, performing tests or anything like that. Just go talk to them, ask questions, be curious. That's the biggest thing. And if you establish those relationships early on, especially within the first few days, patients and clients are going to be a lot more comfortable working with you and conversing with you later on. They've seen your face, they've talked to you, they know a little bit about who you are, they're ready to roll. But the flip side of the coin is if you don't introduce yourself or talk to patients early on, you're going to find yourself around weeks 2, weeks 3, not having introduced yourself, and then having a lot of awkward encounters. Like, who's this guy? I've seen him walking around, but he hasn't really said anything. Like, what's going on with that? You don't want to put yourself in those situations. But oftentimes, especially if you're a student, your CI is going to help facilitate some of those introductions. So let them know, like, if there's any specific way you want to be introduced and go from there. Once that introduction's taken place, the easiest entry point to conversation, especially with new patients, is get them talking about themselves. Some topics or things that you can ask about if you're struggling with. I mean, these might seem basic, but they're things you can always go back to. You can ask about their injury or why they're in rehab. Is this their first time in rehab? How's rehab been going? You can ask about their family. People love to talk about their kids, grandkids, any pets they might have. We talk about the area surrounding the clinic. This works well, especially for away rotations. Like, how long have you lived in the area? Do you have any recommendations? Hey, I'm new to the area. Like, point me to the right, food, entertainment, or so on. This is always helpful too, because you'll get direction for like things to do on the weekends, where to meet people, all that good stuff. Local or professional sports. Everyone likes to talk about sports. That can be very easy, especially if you're into sports. Up next, food or cooking. Everybody loves food. Oftentimes that can be a really solid place to connect. Will light up someone's face as soon as you ask them. And then travel is another good piece to kind of throw in there as well. Those are just a few topics, but there's so many different ways you can start a conversation. So that'll give you a good start and hopefully lead to, some back and forth and additional conversation. But a mentor of mine once described to me the patient interaction very similar to dating or hanging out with someone you like. You ask a lot of different questions, try and get to know each other, get to know the other person better. Obviously, this isn't for romantic purposes, but the carryover still exists. You're trying to build rapport, develop a sense of trust that's going to lead to, positive clinical outcomes down the line. And once that initial rapport is established, follow up on stories, follow up on weekend plans the next time you see the patient. So most medical record systems are actually going to have sticky notes where you can leave yourself a little note before you see the patient the next time. So I'll oftentimes actually write down different topics that I talked about with the patient, as well as interests, what family situations are, if they have any pets, just so you can pick the conversation right back up. So I see, okay, here's what injury they're dealing with. Here's a little bit about them. And then you can just dive right in, and it makes things a lot easier to feel like you've got a connection with your patient. And this is incredible, because you'll be amazed how patients light up when you mention their plans, their pets, what they were going to cook. It just makes things a lot more personal and helps to strengthen those relationships quickly. So that's really the essence of patient interactions. We'll dive deeper into navigating the situations in other videos. But I think it's important to, at least cover those bases here. And then I'd be doing you a disservice if I didn't at least touch on patient refusals. So it's important to be aware that there may be situations where patients refuse to work with you as a student, even as a clinician sometimes. These cases can be a lot of times more about the patient than it is about you. It's important not to get discouraged in these situations, because you can learn a lot from, maybe why they refused. Did it have something to do with culture? Did it have something to do with religion? Did it have something to do, with not want to work with a male or female? But, kind of look at how those around you navigate those situations, see what sorts of things they do. And then, follow up with whoever ends up treating that patient, kind of learn a little bit more about, why the refusal took place. And then if you're a student, you have the opportunity to observe. So through observation and watching how your CI navigates those interactions, there's still a lot you can learn from those encounters. So this was meant to be, a brief overview on how to take advantage of, patient interactions, making the most out of those relationships with patients, and how to effectively communicate with the patient population you're serving. Because at the end of the day, you need to be able to communicate well with those you're working with. And it makes such a big difference if you invest a little bit of time into learning how to be a more effective communicator. So hopefully you can take some of these tips and tricks into clinic, and I know it's going to serve you well. So if you enjoyed it, like and subscribe to the channel. I really, really appreciate it. I'm going to keep putting out more content. Have a great rest of your week.